esophageal cancer. It affects middle-aged men, and the cause of this deadly disease may surprise you. Here's NBC's chief science reporter, Robert Bazell.
There you go.
Bart Frazzitta, a businessman whose hobby is racehorses, was diagnosed with cancer of the esophagus 2.5 years ago.
First time I basically heard about it was when the doctor told me I had it.
That is an all too common revelation. In fact, the esophagus, the muscular tube that connects the back of the throat to the stomach, is becoming an increasingly common site for an especially life-threatening form of cancer. The incidence has shot up 20% in the past decade. This year, more than 13,000 Americans will be diagnosed with the cancer, and almost as many will die from it. Twice as many men get the cancer as women. Why is it going up? Frazzitta, like many people who get the cancer, had bouts of acid reflux, also called GERD, regurgitation of bile from the stomach. Studies show that increases the cancer risk, but he did not think much of it.
There was no really need to think about going to a doctor to have it checked out.
Frazzitta was also overweight, and that increases the chances of reflux. Another theory, not proven, is that drugs called H2 blockers may play a role. Millions of Americans take the drugs, Tagamet, Pepcid, Zantac, Prilosec, and Nexium, to treat heartburn symptoms. Dr. Manjit Bains, an esophageal cancer expert, says while the drugs effectively treat heartburn, they may make a critical change of chemistry in the esophagus to increase cancer risk.
It's almost coinciding with the introduction of H2 blockers, the rise in the incidence of esophageal cancer.
Most patients like Frazzitta are diagnosed at a late stage that can be difficult to treat. He has had surgery, radiation, and experimental chemotherapy, hoping he has beaten a disease that is attacking ever more Americans. For today, Robert Bazell, NBC News, New York.
Dr. Valerie Rusch, Chief of Thoracic Surgery at New York's Memorial Sloan Kettering Cancer Center, is here with more information about this type of cancer. Dr. Rusch, good morning. Thanks for joining us.
Thank you.
It really is quite amazing. Esophageal cancer is the fastest growing cancer in this country. Tell me about the increases that you've seen.
It's been really a remarkable shift in the last couple of decades, and the increase is primarily in middle-aged Caucasian men.
And it's gone up, what, 450% or
That's
something
right.
In some cases? Is
That's
that right?
There's also been an increase in African-American men, but more so in Caucasian men, for reasons that we don't completely understand.
Obviously, you haven't done enough studies, but anecdotally and sort of just pragmatically, as you look at these cases, do they have any links or do you have any feelings what might be causing this increase?
Well, certainly we know that adenocarcinoma of the esophagus, which is the type of esophageal cancer that's increased rapidly in the past 2 decades, is probably linked to GERD, as you heard in the previous segment, and to something called Barrett's esophagus, which is a change of the lining of the esophagus. It leads to precancerous changes, which then over a period of years can progress to cancer.
We heard in Bob Bazell's piece talking about acid reflux and the medications that people have been taking. What are they called again? They're called
H2 blockers.
H2 blockers. Right. But you don't have any empirical evidence heretofore about what acid reflux or these medications may be doing, just suspicions?
Right. It's probably more complicated than that. It's probably related to lifestyle changes, dietary changes, increasing obesity, a number of different factors, and we certainly don't fully understand those as yet.
When you say lifestyle changes, what do you mean in terms of exercise and diet? Are there things that people can do in terms of foods they can avoid that would reduce their risks?
Not that we know for sure, but certainly obesity and is related to an increase in the frequency of GERD, and so obesity and diet can have a relationship with this.
And GERD again stands for?
Gastroesophageal reflux disease.
Now, you don't want to overly alarm people and have them stop taking the medication that may reduce acid reflux and heartburn at this juncture, do you?
That's right. That's right. I think the most important thing is to understand that if you have consistent symptoms, that you need to seek evaluation with a gastroenterologist.
And in fact, early detection is really key because this is quite curable up till stage 3, is that right?
That's right. And so if we detect this when there are precancerous changes or there's a very early cancer, there's an extremely high cure rate with surgery.
All right, well, let's go through the symptoms so people watching or wives or girlfriends or mothers, because women do get this, just not as frequently as men, correct?
That's exactly right.
All right, one of the symptoms, I guess, is persistent heartburn.
Right.
Tell me about that. When you say persistent, does this mean daily heartburn or what?
Well, certainly something that's consistent over days, weeks, months. It's not the one episode after you had too much pizza to eat.
All right, but also you shouldn't just be popping Tums or Rolaids if you're experiencing this. You should talk with a gastroenterologist preferably or your internist about this.
Well, certainly talk with your internist, but if you have consistent symptoms, you need to be endoscoped, have an examination of the inside of the esophagus to see if there are changes or abnormalities there.
One thing I think we should point out, in an annual physical exam, there's really no test for esophageal cancer that would indicate somebody had even the early stages of it. So you really have to pay attention to the symptoms if you want to catch this early on.
That's right.
The other warning sign, difficulty swallowing.
Right.
Now, can you explain that?
Well, usually it's difficulty swallowing solid foods to begin with, and as tumors grow, even semi-solid foods or liquid foods can be difficult to swallow.
Is that an indication if you start choking on things that the cancer is fairly advanced?
Generally, yes.
All right, another warning sign is painful swallowing.
Right. So some patients will have actually like an ulcer on the inside of the esophagus, or what we call esophagitis, inflammation, and can have painful swallowing because of that.
The last is a hiatal hernia, and people who have hiatal hernias, they know who they are, right?
That's correct.
And tell me what exactly that is and how it can contribute to esophageal cancer.
Well, it's probably because there's increased incidence of GERD with hiatal hernias.
All right. Now, the next step is usually surgery in the early stages if it's diagnosed early?
That's right. If the precancerous changes, what we call dysplasia or high-grade dysplasia, are identified, or if there's a very early superficial cancer, those are indications for surgery.
If the cancer is more advanced, then chemotherapy and radiation is recommended, usually prior to surgery?
Frequently. Now, this is a very controversial area. Still not entirely clear how much preoperative treatment with chemotherapy and radiation contributes or improves survival. But the key thing is that patients do need careful multidisciplinary care in a center of excellence where there is a team approach to the management of this disease.
All right. Well, Dr. Valerie Rusch, thank you so much for coming by, and hopefully people who have these symptoms will pay attention and get to a doctor so they can be carefully examined.
Thank you.
Thank you. And we'll be back with more of Today right after this.
My problem